Hello, everyone, and welcome to another episode of Skintox.
Hello, hello.
Hello. We're lucky to have, obviously, my co-host, Andrea, to this side, and we're very, very lucky to have the wonderful Dr. Van Aardt underneath us. Welcome to the show, Dr. Van Aardt.
Thank you
Hi.
so much for joining us.
Thanks for both of you for having me on. It's great.
No, it's awesome. It's awesome that you can join us. Now, just before we get into things, I just want to say a big shout out to all you Skintox fans out there. I think this is episode 5 now, we have over 3,000 views on all episodes. So that's pretty awesome for, a small guy in Ottawa like myself and a wonderful nurse injector in the Halifax area to have that many viewers watching our video. I hope you're enjoying the content. As we say every episode, please reach out to Andrea or myself if you have any questions or you want a professional from our industry to come on to this platform. We will do our best to answer the questions, and if we don't know the answers, we'll reach out to the professional that does. And we look forward to keep giving you this content as long as you keep loving it. So feedback is great. So without further ado, I'm going to pass it on to Andrea, and she is going to start asking Dr. Van Aardt and put him in the deep end with some questions.
All right.
Let's go.
Okay, so Dr. Van Aardt, so you've been in the industry for many years. So kind of give us a little bit of background.
Can't hear you, Andrea.
You can't hear me. You can't hear me at all. Can you hear me now? Oh no! Can you hear me, Nathan?
Is the mic on?
I can hear you.
My mic is on. Oh
Okay.
no!
Well, you know what? I'll start asking question. Andre, you just try and get your audio sorted. So, Dr. Van Aardt, we'll start with me then. So, my first question is, what's it like to work with this wonderful person I have next to me?
Well, I'm very privileged to work with Andrea. I think the qualities that Andrea has is, I guess that's something that attracted me to working with her initially. Talk about a person with passion and perseverance, and just so focused and keen to succeed. That's Andrea, and all with a smile every day. She's a very pleasant person, as you all know. It's a great privilege, and I think I'm very lucky to have Andrea as a partner in our practice.
Thank you.
Yeah, and I must say, you guys just work so well together, and it's always so refreshing to see you at events or see you guys in the clinic. I think you guys have such an amazing connection, and for those of you who don't know Andrea and Dr. Van Aardt, please reach out to them at Vitality Vibe or Truro Medispa, the closest clinic to you, because they're wonderful people to get to know and to ask advice around the medical aesthetics industry. So my next question is, and this question is an important one because Dr. Van Aardt, I don't think people understand who are outside the industry how much education you as physicians or professionals do on a yearly basis. Like, I see you at so many conferences throughout the year. I know you do a lot of online training. You're always doing training to better your skills, to better your knowledge. And that sort of leads me to the question of, is there any sort of technology or anything innovative coming out very soon that you think is going to change the market?
Yeah, that's something that's always at the top of mind. I always think about that and ponder that. Good question. On the one hand, you kind of wish you had a crystal ball to know what the next thing is, because if you did, you could strike gold, right?
Yeah.
But at the same time, being in the industry, you do sort of think about everything that's happening and see it in perspective and wonder what the next thing is going to be. I think there's a lot of promise in stem cells. Yeah. What I've seen about stem cell technology and what the potential is, it's exciting. The problem there is the approval from our regulators in that regard, because it's going to take a long time to get the studies done correctly that would allow for approval for it. Now, it is approved, luckily, in many medical indications, fortunately, like someone that has been on chemotherapy for leukemia, they need stem cell transplant to be able to repopulate their bone marrow and so forth. So, those are medical reasons. But when it comes to cosmetic use, I think the bar is set very high for approval and for safety, which is rightly so. But I think that's something that's going to be on the horizon for us. Just hard to know when that's going to be. Apart from that, I think refining everything that we do currently is an evolution that I've noticed over the last 20 years. And so it's not so much the next great breakthrough, but things are moving so fast that a year from now, there may be new techniques, new applications, or new uses or techniques that we're using to inject the filler substances that we may not even have thought of now. So I think there will always be something new. With regards to energy devices and lasers, we might be surprised by the next new thing.
Yeah.
However, there hasn't been a lot of new things as of late. The most recent new technology would be the electromagnetic energy for improving muscle tension and some slimming. That really was the most recent. I think this is going back 2 to 3 years now that this has been on the market. And there's been nothing groundbreaking since then. But yeah, I'd love to know what the next big thing's going to be. But I guess we're just going to wait and see, because there's nothing that I'm aware of besides what we're doing and the stem cells that I've mentioned that's on the horizon as far as I know.
Awesome. Thank you so much for that answer. It was very comprehensive. So let's talk a little bit about your bread and butter and injectables. And we all know that you do that very, very well, and you've been doing that for many, many years. Just from your point of view, I would love to know, from your point of view, for someone that maybe is thinking about getting injectables done, or maybe doing some medical aesthetics work done, when it comes to injecting, where is the part on the face that you feel when you inject, whether it's filler or neurotoxin, patients get the most benefit, and maybe that the better version of themselves from that freshened up look?
Mm-hmm. I'm going to answer that with 2 answers.
Okay.
Because it's a good question, but it's also kind of a loaded question, because there's many caveats to it. So first of all, the correct answer is the most important area to inject is what's most important in the individual. And this is why this is something that we have to customize to every single person, and why we spend time to do consultations and proper assessments to understand the person's needs. And we are all different, right? So there are many genetic differences and age differences that come into play. One person may have a weak chin. Someone else may have lost a lot of volume in their temple. So the important area to inject in an individual might not be what they think is what they need. That's why we do a full assessment to decide, to help them understand what in their case would be the most appropriate to give them the best result, for them to look their best, the most natural and most beautiful way, so that they look great. No one else would know they've had anything done. So if a person had a weak chin, big cheeks, and we're giving them more volume in their cheeks, they're going to start looking freakish instead of looking better. It would be better to create facial harmony in that individual by treating the chin zone. Then they would be the happiest. So that's my first answer. The second answer is, in most cases, the most important area to treat in the face is the midface. This includes the zygomatic arch, or the cheekbone, the mid-cheek, or the apex of the cheek, and the medial cheek. How, where, and when we treat that, again, depends on the individual. However, if you look at an average across 100 patients, about 60 of them, I would say this would be a very important area to treat. So when we do our assessments, it's always an area that we focus on and examine really well, compared to other parts of the face, to make sure that we address that. because when it's needed to be treated, it makes a big difference.
I love that answer. You're coming at me hard here. You're answering me well. Very comprehensive. But that's what happens when you have so much experience like you do. So that leads me to my next question, and this is a little bit more closer to my heart in regards to medical aesthetics. How important, in your opinion, is skincare when you're pairing with certain services like injectables and lasers in your clinic?
In my opinion, it's as important as everything else we do, right? So there's different aspects to facial beauty. To address volume loss, maybe one, to address deep lines and wrinkles, maybe another, but the quality of the skin is really important. So if you have everything else correct, but your skin is dull and sun damaged, it's not going to do all the other features any good. It'll do that a disservice. So skin quality, Andre's going to laugh at me because when I explain things to patients, I always use car analogies, right?
Yes.
I'm a car guy. I love cars and I have cars. So imagine having a Ferrari with a fantastic engine, beautiful steering wheel, and the interior leather is just fantastic, but the paint job is terrible and it's all rusted on the outside. Yeah. You will not appreciate what the vehicle has to offer if the paint job is not up to snuff, right? So it's kind of part and parcel of the whole. And we discuss this with each and every patient when they see us for a consult. You know, skin care and skin quality is integral to everything else that we do.
Awesome. Thank you. Now, I've got one more question before I pass you on to Andre. And before I do, Andre, can you just can you talk so we can see if he can hear you?
Can you hear me?
It's weird.
You can't hear me.
Yeah,
oh, no.
I can't hear her audio at all.
Okay.
Oh, no.
Something that I can do to...
No. I think it's at her end. But if you go into the settings, Andrew, you might be able to have a... Well, I've got one more question while Andrea is playing around with that. Or maybe take your earphones out, Andrea. So the last question is more on a personal note, Dr. Van Aardt. COVID. It's hit us hard, but I want to know personally what, from a positive point of view, what you're looking forward to doing when we come out of this and all the isolations rules are dropped and we can do what we want. What's the one thing you're looking forward to be doing?
So, you know, there's going to be quite a difference when we get back to work after COVID. I was part of on a panel the other evening for the Canadian Association of Aesthetic Medicine with exactly that in mind, and how we prepare for reopening. We will do our very best to offer the service at the same level as before. However, there'll be some screening involved. So our patients, when they call in, we'll ask them questions about any symptoms or maybe recent exposure. When they come for their appointment, we will ask them the same things over again. They will have to wait in their vehicle, though, until and give us a call so that we can bring them into our office. We're going to reduce the amount of people in our office, so appointments will be a little longer to allow us time to prepare for the next person coming in, because we're going to be very strict with sanitation and you know, minimizing any risk of contamination or spread between people of COVID-19. We're also going to move to a virtual platform for our consults. So anyone that is still in a position of needing questions answered or need an assessment to what they may require to have, we'll assess that online, whereas we'll only book patients for treatments in our office and when it's important for us to assess anything in person. Does that answer your question? Because there's lots more that I could talk about.
Yeah, no. I also want to know what you're going to do personally. Like, what's the one thing you would like to do personally? Like, is it to go to a nice restaurant? Is it to
sorry.
Go... Yeah.
You know what? I think I answered it because I just want to get to work.
Yeah.
You know, sitting at home for a few weeks like this, you really get itchy to get get to work. And as you know, Andre and I are both very passionate about what we do, and we miss our patients. We miss just doing our craft. The art and science of what we do is something that is very important to us, and can't wait to get back to that. We're going to put any travel or other things on the back burner for a while.
Yeah, and I totally get that, because I know how proud of how you guys are of what you do, and how much passion and how much energy you throw into what you do. And I can imagine how it feels, because I feel the same way when someone takes something away from you that you feel so passionate about. It's very hard to deal with. So I feel for the two of you. But you know what? I think we've got through the worst of it. And I think we're soon to come out the other side. Our good friends British Columbia, and your very good friends New Brunswick look like they're coming out in May the 19th, which is, I think, great news for the whole country, that there may be light at the end of the tunnel for all of us very, very soon, as long as we just keep to the social distancing and follow the instructions from provincial government. So, Andre, we'll give you another chance. Can you
hear me?
So, Andrea, what I think we'll do, because somehow my audio is not working, or I can't hear you.
I'll ask.
Andrea sent me her questions, so I can address them one by one, and you know, so there's more ways than one that we can use technology. So thanks for sending those questions, Andrea. Andrea has asked me how I got into this area of medicine, and what made me decide to go this route.
Yeah,
that's a very interesting story. How much time do we have, really? But you know, to answer in a short way, back in 1999, there was not much going on in cosmetic medicine. There was plastic surgery, and some dermatologists were doing laser resurfacing. I was always intrigued with lasers from a young age, right? So when I got a brochure about you can offer laser treatments in your office, that really intrigued me. So I sent for a brochure, looked at it, you know, I just laid around for a while, got a call from the representative that said, you know, there's a speaker coming from New York to Toronto to do a talk on lasers. Would you like to attend that? And it just happened to be on a weekend that I was free, which there were not many of those. I worked 3 weekends out of 4 typically. So we needed a break. So we went to Toronto for a weekend, and I met Dr. Mark Lupin at this conference, and he was instrumental in motivating me to buy this machine that cost more than my house did. It was a huge leap of faith. I mean, people thought I was nutters. The other doctors, they thought I was crazy, because I'm in a little community of like few hundred people on the outskirts of Yarmouth, Nova Scotia, which is a sparsely populated area anyway. And here I was offering laser hair removal out of my medical office out in the sticks. But you know what? Within a month, we were able to make the payment on the machine, and it just kept growing, and it went from there. And as I said, there's lots to talk about, because it's interesting how it evolved. But hopefully, Andrea, that answers your question.
It's a lovely story. It's a lovely story as well. I love stories like that. I
kind of grew up with aesthetic medicine right from the onset, and met people that I'm good friends with to this day that are very big voices in the area of aesthetic medicine. So that leads us to Andrea's next question. She's asking me, how has the medical aesthetic industry changed over the last 20 years?
Yeah.
Which is kind of what I was just about to talk about anyway, because things were evolving. So when I started doing laser procedures, I didn't even think about fillers, for instance. At that point, we had Zyderm and Zyplast available to treat little acne scars and tiny lines around the mouth. And some doctors were starting to use this off-label to inject lips. But the problem was this was animal-derived collagen, and many people were allergic to it. So and it didn't last more than 2 or 3 months anyway. And it was painful. Our techniques were a far cry from what we do today. But anyway, in 2001, Restylane was the first product on the market that was approved as a non-animal derived hyaluronic acid, which changed the game. And I remember getting a kit from the distributor saying that never inject this below the skin. It should only go in the dermis of the skin. But as time went by, just instinctively, I started placing it for volume loss. And patients were very happy with that. And we used it, in more and more areas. And this evolved. The energy device industry changed dramatically over this time as well. Basic lasers became more refined, and we started moving towards fractional laser technology, so it became a lot safer. And I guess we all became much smarter as to how we utilize all the tools available to us in helping our patients get the best end results. So in a nutshell, that's sort of how I've seen everything change. It's been quite a change over the last 20 years. I might lead into Andre's next question. Andre, was there anything else you think that I should expand on there, or are we good to go with the next question?
I think that was pretty good.
Just give me a thumbs up if we should move on. Or
I think we're good.
So she asks me, with the many different modalities that we provide, is there one service that I like to perform more than another? I like working with my hands. Always having a knack for surgery. I like everything I do with my hands, basically, but it's very hard to pick one. I think my favorite for the last while is ThermiTight, just because it's more surgical and we have to drape the patient in sterile fashion. It's a little more dramatic from that perspective. So that's a big favorite of mine. The other one would still be the fillers, because it's the most immediate impact that you can get in one single treatment. So that's from a patient's perspective, that's definitely the most favorite. And of course, if a patient has a big smile on their face after treatment, that's important to me as well.
Can you ask him to
I guess those two would be at the top of my list.
Sorry. So Andrew's got one more question. I'm just going to pass it on.
Can you ask him to explain maybe ThermiTight a little bit to our viewers and get him to kind of explain that a little bit?
Dr. Van Aardt, could you explain ThermiTight to the viewers and what it does, what are the benefits, and who's a good patient that fits for that service?
Yeah, so it is about 18 years ago that a technology was made available with radio frequency energy to treat the skin, to cause the skin to tighten and contract, a skin tightening technology, if you will. And the initial devices were not that good. The procedure hurt a lot, and it was very slow at producing results. You literally had to do one treatment every single year, and over time you would see modest effects. Now the technology improved substantially in a non-invasive way over the years, but it still has limitations, because if you're putting a probe on the top of the skin, you can only heat the skin to a certain point before you would get a burn, and we never want to injure the skin or create side effects. So we had that limiting factor. We could never get the energy any higher than a certain amount, maybe 45 degrees maximum on the surface, before you would run into trouble. So ThermiTight circumvents this, and it's an ingenious way of actually delivering substantial results in a single treatment using the same energy that we know over the years is very safe. So we have a little probe that we can actually allow to glide in the plane right below the skin. So it's a little invasive, but only with needle pick entry points. So there's 3 of them under each ear and under the chin. Tiny needle, so you don't need a suture after. There's no scars involved. Through those entry points, we numb the whole area, and then we can actually slowly and slow and steady, we can heat the entire area very, very evenly to a much more effective level and still keep the skin safe. We actually monitor the skin's temperature using an infrared camera. So we can see on the screen, and Andrea keeps her eye on that like an eagle to make sure that we always stay safe yet very effective. And at the tip of this little probe, there's also a thermometer. So we can actually see what the temperature is inside the tissue as well, and make sure that we heat the entire area under the skin of the lower face, jawline, and neck very, very evenly. And we've also used this technology on the abdomen, as well as the arms. It can be used on the thighs, and there's some other applications for it too. But it's an amazing treatment with a much more predictable result that lasts a number of years.
Awesome, thank you. And Dr. Van Aardt, we've just got a question I'm going to bring up on your screen from one of our guests. Can you see that?
Yeah. So can I explain why someone should start using tightening modalities at their first sign of aging? Why
Yes.
someone would? All right. Well, this is inherently part of being human and getting older. Unfortunately, our body's wound healing response slows down, which is linked to hormonal decline. And up to the age of about 28, we tend to maintain our tissue integrity really well. Our skin, our bone, our organs, they can maintain their size, their integrity, and as well as the function quite well. But as the hormone levels start declining, which is an indicator of how we age as well, and it's inevitable, happens to us all, the amount of cell replication, the amount of production of collagen, and other connective tissues, they actually decline. So we find our organs shrinking, the function goes down, and our skin is the largest organ in our body, and unfortunately it declines as well. And the thickest part of the skin, the dermis, the deeper part, is full of collagen and elastin when we're young. But as it loses those proteins, the skin shrinks and becomes less elastic, so it begins to stretch. And as the skin stretches, it becomes redundant. So it means there's extra loose skin, So think about someone that's pregnant, and after pregnancy, once the baby is born, there would be loose skin on the stomach because the skin was stretched over a period of time, and then you end up with redundant skin. Gravity has the same effect on our skin everywhere. So we develop saggy skin on the face and neck and arms, and unfortunately, all the other areas of our body. So what we can do to remind the skin to repair the tissue again and revamp collagen growth and keep the dermis nice and strong and elastic is expose it to these energies. And we have a few modalities. It's not just energy devices. Amongst the energy devices, there are ultrasound, radiofrequency energy. We can use laser, intense pulse light, as well as injectables, which can also stimulate the collagen growth. So we have all these options to us, but the non-invasive ones at an earlier age is obviously best, right? It's the safest way. So I suggest around the age of 35 to start looking at receiving procedures with radiofrequency energy, for instance, that would stimulate collagen growth and remodeling in your skin so that your skin remains elastic, firm, and strong. Prevention is always better than cure. If you start early, you're not going to need a facelift later. And this is literally where we are today with our technology and what we can do in cosmetic medicine. We can help our patients not need surgery later in life and always look their best for their age.
Awesome.
Andrea has also asked me if I've seen a shift in men having treatments done over the last few years, and I would say absolutely. More and more men are seeking out these procedures, becoming more educated about them, and I guess not as shy, or I guess the stigma associated is gradually being lost or dissolving. So men are more eager to come in, and honestly, they're always very, very satisfied customers. They typically know what they want. They've researched it and have it done, no problem, and they're very happy afterwards. So I think that's great, and hopefully more and more we'll see the shift happening and continuing.
And can I add to that, being a male that in the industry, but also someone that also loves to be pampered in the industry as well, is I find getting treatments done, using good skincare, I find it, for me personally, it's such an amazing feeling. I like the way it feels on my skin. I like the way it feels when I touch my skin. Oh, sorry. So we're having some technical difficulty here. I also
just
like
had a phone call.
Yeah, sorry.
I just had a phone call come through, so it kind of
That's all right. Yeah.
me.
And I also like the way.
And now I can't hear any of you.
Oh, you can't hear us.
Oh dear.
Can you hear us now?
Okay. We're having difficulties today.
I don't know if there's a way that you can re-sign me in or something. That
I'll try and do this here. We'll try and bring him back in here. Are you in now? Can you hear us now?
Yes.
I can't hear anything.
Oh no! Can you hear me?
I can hear you, Andrea. Yeah.
You can hear me.
And we can hear Dr. Van Aardt. So that's okay. We've basically got all the questions answered that Dr. Van Aardt was going to ask today. So we will we'll probably close up there before we have any more technical difficulties.
We'll do another interview with him when we're like.
We'll do another interview with Dr. Van Aardt as well. But thank you so much for those tuning in. This Friday, who do we have on this Friday, Andrea? We have Judy Donato this Friday. We have Dr. Landells from Newfoundland the next Friday, and we're looking to jack someone up midweek next week as well. And we're going to do another interview with Dr. Van Aardt in the next couple of weeks as well. So please keep reaching out to us. Thank you so much for all the feedback that we've been getting over the last few weeks. Andrea and I are loving bringing this content to you. As long as it's still valuable, we'll keep doing it. A big thank you to Dr. Van Aardt underneath us. Thank you so much, Dr. Van Aardt.
Thank you.
We will talk to everyone soon. Keep looking after your families. Keep staying safe. Practice the social distancing. New Brunswick and BC got some good information this week. Hopefully, other provinces will start to get more good information as well, and we'll be out of this, and we'll be able to go visit people like Dr. Van Aardt and Andrea in his clinics. If you want to get hold of Dr. Van Aardt, check out Vitality, Viable, True, Medispa spas, or catch him on at Dr. Van Aardt on Instagram, or he has his own website at drvanaardt.com. Thank you very much again from the team at Skintox, and we will see you very soon. Cheers.
Thank you.